Hey everybody, I hope you had a lovely weekend, and if your weekend included you going to the gym or doing anything outside and involved using your shoulders, then today we want to talk about why your shoulder might be hurting and what you can do about it. So everyone, I'm Dr. Alex Ritz, a downtown Toronto neurostructural chiropractor, and today we're going to be addressing shoulder pain, some of its causes, especially if it's shoulder pain that you experience at the gym or with being active, and what you can do about it. So most people that experience shoulder pain, especially shoulder pain that comes from the gym, they usually will localize it to the front of the shoulder in kind of this area right here. And stereotypically, that's what ultimately gets diagnosed as impingement syndrome, by which some sort of tissue, either one of the rotator cuff tendons, the long head of the biceps, or some sort of tissue like the bursa or a part of the joint tissue or synovium, is irritated from repetitive strain. And then anytime that you decrease the space between, the arm bone here, the humerus, and the acromion, which is part of the shoulder blade of the scapula, anytime you decrease the amount of space in here, like this, or with overhead movement, that's where you can get an impingement of the tissues and some irritation. Now, the really challenging thing when dealing with these shoulder issues is that, number one, they're really, really annoying and painful. And if you've had one or experiencing one now, then I can almost guarantee you it's stopping you from enjoying the things that you like in life and being active, and definitely stopping you from enjoying being at the gym. You might even notice that with reaching into the back seat can be quite irritating. So when I think about managing these issues and you managing them, we're going to approach it with in three different ways. And we're going to think about it in those three different ways based kind of on the anatomy or the pathophysiology of what contributes to this impingement problem. So if you've seen a more traditional chiropractor or physiotherapist and you've had one of these impingement issues, then they've probably just looked right at the shoulder, focused on the shoulder, where the pain and where the problem is, and gone about treating it that way. Now, I want to take a small step back. Even if you've never had a shoulder issue, I think this video is going to be very valuable because we're going to be talking about how to avoid it. So anywho, you've been to your physio or traditional chiropractor, they've looked at your shoulder, they tell you that there's some impingement, there's an irritation of the tissues, and then they give you some exercises like doing your pendulums, put some ultrasound on it, or some acupuncture, and then it might get better, but it's probably going to come back. And so the problem with addressing only the shoulder, like any other injury when you're addressing only where the pain is that it's not the full picture of what the problem is. So when we think about the shoulder as being a problematic area, there's a few things that can contribute to it. So number one is actually how the shoulder joint is moving. Really important is number two is how is the shoulder blade and the spine affecting how the shoulder is moving. And then number three, which a lot of people don't think about, is how is the nervous tissue in the neck, with all of those muscles and nerves that travel down from the neck to the shoulder, how is that affecting the shoulder? And in my opinion, I do not think that you can resolve a shoulder issue without addressing all three. And here's why. So number one, a lot of people, when they have some sort of impingement issue and an irritation through, say, one of the rotator cuff muscles, when you have some of this issue, I don't think it does a lot of good to do any exercises in through the air when it's in the acute phase. If it's acute and painful, let it go. The body will work to heal itself. It is very, very good at that. And I think a lot of movement, if it's a painful movement or in the painful range of motion, can aggravate it. Now, if you're just doing some pendulum exercises and keeping the shoulder moving well, just to keep some pain-free range of motion, I think a pain-free range of motion is really, really good and something that we can all practice if there's a shoulder problem. But what I think is most important to address during this acute phase of pain while you're resting is what's happening in the neck and those muscles that travel down, what's happening in the shoulder blade. And so let's talk about the shoulder blade for a second. When we think about overhead work, a lot of movement is going to come from the shoulder joint itself, but a lot of the rest of, anywhere from 60 to 90% of the movement, is actually going to come from that shoulder blade moving and rotating along the thorax. And so if you have a problem with the way the shoulder blade moves, it's going to be really, really difficult to move overhead perfectly well. And in detail, what I'm saying is, if, say, the glenohumeral joint moves perfectly to 90, 100, 110 degrees, but the shoulder blade is stuck, trying to get it overhead, you're going to be really jamming the shoulder, or the glenohumeral joint, to make up for what you're missing here. So if you're missing movement through the shoulder blade, it's going to be tough to get the arm up overhead, and it's going to add some extra strain to the shoulder joint. So this is why getting the shoulder blade into the correct position and getting it moving properly is really, really, really important. Now, another part about that is, if you have a poorly structured spine, if your spine is rounded and the shoulder blade is tilting forward, this is going to cause two additional problems. Problem number one, again, it's going to be tough to move that shoulder blade so that the shoulder can move properly. And then number two is that if your shoulder is really tilted forward because your spine is shifted and you are tilted forward, it's going to create even less space here in the front of the shoulder joint. If you have less space, it's going to create a situation where there's a greater risk of impingement. So as an example, when we assess somebody that has a shoulder issue, we spend a lot of time focusing on how the shoulder blade is moving, but especially how that mid-back or the thoracic spine is moving, and what position is it in, and what position as a result is the shoulder blade in. And we work to correct that so that down the line, when you've fixed this, the position of the shoulder blade is still not a problem that's going to keep this coming back. So you can imagine, you can rest this, you can heal this, you can acupuncture, ultrasound, whatever, as much as you want, but unless you fix the position of the shoulder blade, its movement, and the thoracic spine and the mid-back, you're not going to make up a lot of ground for this condition. Now, number two, I don't know what number we're at. We're going to talk about the neck now. In terms of the neck and the nerves and the muscles that go down, you can imagine that if you have a shift in your spine or irritation in the spine that puts stress on a nerve, if that nerve goes down to a muscle, is it going to make it stronger or weaker? And you're saying to me right now, it'll make it weaker, of course. Now, let's say one of those nerves is a sensation nerve. It travels down from the neck, it goes to the shoulder. If you put stress on that nerve, is it going to make it more tolerant of pain? Is it going to give it a higher threshold before you feel pain? Or is it going to make it more sensitive? And you just told me it's going to make it more sensitive. So if you have a lot of irritation or stress in the neck, either because you're shifted forward, there are small shifts or irritations in the spine, or a combination of both, those nerves that are irritated that come down to the shoulder, they are going to make it more pain sensitive and make you more sensitive to an injury. You're also going to have poor function of those muscles in the area, and as a result, more likely to get injured. Now, this is not me just making stuff up. If you, I will link a fantastic journal study in this live. If you're on Facebook, you'll have to check it out our Facebook channel because I can't do it on Instagram. But if you check it out, a title called "Why Does My Shoulder Hurt?" Really fantastic study that I point to a lot with our practice members, and it talks about this nervous system connection with the shoulder and how important it is. It even goes on to talk about how useless is the wrong word, how ineffective or how little effectiveness there is with doing orthopedic tests of the shoulder to try and make a diagnosis, because they're not very sensitive or specific. And that means that when you do all these orthopedic tests for the shoulders, even if one shows up positive or negative, it actually doesn't give the doctor or the practitioner very much information in terms of what is wrong. They can't tell, is it, the supraspinatus tendon or the infraspinatus tendon, the biceps tendon. If you can't find out during palpation, these orthopedic tests are likely not going to show you. And so again, that is why assessing the overall function and structure of the shoulder is probably more important than doing a couple of orthopedic tests that you might have had at a more traditional chiropractor or at your physician's office. So when we come back to addressing the neck, part of the neurostructural restoration process that we go through in the office is to make sure that that neck gets more stacked up, that the nerves communicating with the shoulder are, of course, healthier, and that you're going to have a less sensitive nervous system causing less pain in the shoulder. So as a recap, if you've had pain in the shoulder, it is probably due to some sort of impingement issue in the shoulder. likely contributed by shifts through the neck or a shift in the structure of the neck, causing irritation of those nerves, making the shoulder more sensitive. And this can also be from increased repetitive strain because of poor movement of the shoulder blade and maybe poor positioning of the shoulder blade because of the spine. So since we know the 3 pathophysiological reasons why this might occur, it's easy to manage this condition if it's happening to you or prevent it. Easy things are, number 1, reduce repetitive strain on the shoulder by making sure that whenever you're doing an activity, you're doing it with good technique. So if you're doing an overhead press, we don't want the shoulders back here. We want them about 20 degrees forward, in line with where the shoulder blade normally points to. It doesn't point out there, it points out here. When you're doing overhead press, making sure that you keep that nice angle and that the neck and the chin are stacked up nicely. And then if you're doing any sort of activity at the gym, always making sure that your technique is excellent to reduce repetitive strain. Number 1. Number 2, we want to make sure that we're always working to mobilize and stretch the muscles around the shoulder blade, whether it's the latissimus dorsi, the triceps, the pecs, or the rhomboids. They're going to control how that shoulder blade moves, and they need to be loose to allow the shoulder blade to move as much as we would like it to. Part 2 of that is we also need to always be working to make sure that our mid-back and our spine moves really, really well, so that, number 1, you're not shifted forward and that the shoulder blade is not tilted forward. We always want to be working mobilizing the mid-back to make sure that the shoulder is going to have the best chance to move properly and the shoulder blade the best chance to move properly. In terms of solutions for that, I have given out so much free stuff on that, guys. Check out some of the foam rolling through the mid-back. Check out any of the corrective exercises through the MOVE curriculum, or go back through our feed in January where we talked about stiff neck and shoulders. So much in there related to the mid-back and to the shoulders. Free, good content that can help you with that. Now, number 3, what we're going to be talking about. Hey, Jason, I'm definitely thinking about you during this lunch and learn. So listen up, my friend. And then the last thing is taking care of your neck. So if your neck is really shifted forward, putting stress on the nervous system, that is something that you're going to want to correct if you want to give your shoulder a chance. The short process of that is getting professional help. The long process of that is daily and sometimes twice daily corrective exercises, stretching, mobilization to get the head stacked back up and to give to stretch the muscles through the cervical spine or the neck and to make sure you take some stress off those nerves going down to the shoulder. Again, lots of good stuff in our Instagram content from January that can help you with that. That's what I got for you today, guys. That is a shoulder issue in a nutshell. I was at the gym on Saturday and I overheard, and I always eavesdrop on people. So if you see me in the gym, I'm eavesdropping on you to listen about your injuries. And a gentleman was talking to one of the trainers saying, yeah, my shoulder's sore through here. It's probably a tear in the rotator cuff. And, I'm going to do some exercises. And if they hurt a bit, that's fine. And I don't think it's very professional for me to approach a stranger. And I was crying a little bit for this guy because if he just knew this material, he would be able to better manage his shoulder issue himself. And at least he would know somebody if he needed a professional hand. So on that note, I'm going to ask you guys, if you know anybody that has a shoulder issue that needs some help, tag them in this video. Comment on this video. Send this video to them. It will help them. They will be thankful for it. If anybody has any specific questions, I please ask you, send me a DM or send us a message on Facebook or send me an email. Whatever you need, I will do my best to help and assist. In terms of some of the links, I will add that to the Facebook video by the end of the day, so check back. I'm going to try and do that right away. And I hope everyone has a wonderful, wonderful Monday. I'm going to sign off. I got lots of work to do. Maybe you can head out on the bicyclette. Take care, guys. I hope that was a great lunch and learn for you. Bye.